And last week, New York Governor Kathy Hochul signed a bill into law allowing for medical aid in dying, or MAID, by way of an oral liquid prescription.
Now, the law starts off quite structured and restrictive. The patient must be terminally ill with only 6 months to live, confirmed independently by 2 doctors. The patient must also have deemed to have the decision-making capacity to understand what they're doing. And then there's a 5-day waiting period from when the medication can be fulfilled upon the prescription being requested. The patient also must be able to self-administer the oral prescription. Also, religious care facilities may opt out from participation.
The New York law is said to follow the model set in Oregon and places New York among a dozen states, plus the District of Columbia, now allowing for medical aid in dying.
And joining us in studio now to discuss is Amanda Achtman. She's an ethics director with Canadian Physicians for Life.
So good to have you with us this morning, Amanda. Really looking forward to this discussion. Let's start with the aspect just of the term itself, medical aid in dying. It's actually shifted recently from assisted suicide, the term most people know. Why is that?
In Canada, medical aid in dying, or MAID, became legalized in 2016 and encompassed both assisted suicide and euthanasia. The distinction being euthanasia is where the doctor or nurse directly administers the lethal injection to the patient, whereas assisted suicide is where the patient has to administer him or herself. And so in the United States, as was mentioned, only assisted suicide is legal. In Canada, there's the option for either. And each year, since it has been legal, there have been a handful of people who have opted for the self-administration, but the vast majority opt instead to have the doctor or nurse do it. And in the last year for which we have data, 2024, all 16,499 Canadians opted for that direct euthanasia under the term of MAID.
Now, it seems as if it's been 10 years now in Canada. This law in New York, I just read it and I just got the highlights, but it seems, very specific, very structured. What has been the experience with Canada as it relates to, the specificity of the requirements to allow it?
It's true that initially euthanasia in Canada too had this narrow criteria. There was a need for death to be deemed reasonably foreseeable. So whether that's the term or whether it's a 6-month prognosis, which we know doctors often do get wrong, there was this purported narrow criteria. However, once legalized, euthanasia or assisted suicide cannot remain limited, but must be expanded on the grounds of equality. Because if this is a reasonable and compassionate means to alleviate suffering, then how can you not extend it to people who may suffer just as much, if not more, but not have a terminal illness? And so that is why the eligibility criteria under the grounds of equality necessarily has been expanded in Canada to people with disabilities and chronic illness. And the same will happen if the logic is followed to its conclusion that death is the solution to suffering.
Yeah, this sounds like quite a slippery slope. I know that you advocate against medical aid in dying, and I can see this could be one reason why. If you would like to dig into if there are any other reasons as well, or further explain this.
Quite simply, I believe that everybody deserves suicide prevention rather than suicide assistance. There's nothing that could happen to any one of us that should mean that we are met with a look that says, maybe you're better off dead. There is always more that we can do in terms of love. And euthanasia, assisted suicide, represents a failure to love. We need to always insist that people deserve more and people deserve better. If we say that there's a threshold of illness or disability or suffering that we can't meet and for whom there's nothing we can do, what does that say to the people with the same condition who don't want it? And that's what shows you that this is not just about autonomy or freedom, but it's about creating criteria that gives a social valuation and makes a judgment on the value of life that has a ripple effect for everyone who fits that criteria, whether they opt for it or not.
And to play the devil's advocate, or to understand those who are in favor of it, they say that this is showing compassion for people who are suffering. And as Steph mentioned, you can see how the definition then becomes somewhat of a slippery slope. So what would you say to somebody who, even in just the term, it sounds very compassionate, but clearly, you're introducing reasons why people should maybe think a bit more broadly about the topic and not just see that one moment of suffering?
It's important to think clearly about what's at stake and what's involved. Euthanasia and assisted suicide is the direct ending of a patient's life prematurely. And that is not compassion. That is not a communion in suffering between people who love. It is so inadequate to the suffering and dying person to be, again, met with this discarding and dismissing posture. Another point I'll make is that we tend to focus so much on the individual. As a millennial, I find that the main way that this issue is affecting my friends is that they're losing their grandparents this way. I recently interviewed a friend who lost both of his grandmothers within 2 months of each other. They both opted for MAID. This has gone from exceptional to routine to becoming the ideal way to die. And so we have to decide, is this the way to die, or do we have something better to propose? We have to have something better to propose than death. I think that the request for it betrays a disappointment, not so much as the desire to die, and people deserve so much more. This is creating complex grief, intergenerational trauma, and I hear stories literally every day from people who are affected. So that's why I personally am dedicating my life to this topic.
Can you share a little bit more about what you've learned and experienced north of the border? Because as we were saying, the U.S. starting to follow Canada's lead. Now we have 13 states and the District of Columbia, with the exception of Montana, which is a fiercely liberty-focused conservative state. We do see the trend here in the U.S. more among the more liberal states.
This entire cultural conversation that would purport to offer death as a solution actually makes all of us more precarious, because any of us could get to this situation where we are vulnerable in the particular ways that would render us eligible. In fact, I am more personally concerned about fitting the government's criteria that tells me I'm eligible for a state-sponsored suicide than I am of any terminal diagnosis. That is the toll that it has, and this is what is creating an anxious generation. We might want to attribute it to smartphones or to social media, but think about the precariousness that ensues among the young when, as you age, as you suffer, you opt out of life. This is extremely threatening, not only among the people who opt for it, but even the conversation that suicide becomes normalized or acceptable. That's devastating. We have so many mental health crises. We have so much addiction. And I think I, as a young person, and my generation is looking out and wondering, what is on offer? It has to be better than death.
And Amanda, as we start to finish up, as you said, you've dedicated your life to this issue, seeing that this represents not just the issue itself, but maybe something broader. Could you comment to that as we begin to finish up?
Absolutely. Canada does do a survey, as many of the US states do, on the main kinds of suffering leading people to request euthanasia. And pain and suffering, and even fear of pain, is not in the top 3. The number one kind of suffering, by people's own admission, leading them to request euthanasia in Canada is an inability to engage in meaningful life activities. This indicates to us, by people's own admission, that euthanasia is not fundamentally a medical crisis, but an existential one. And that's why I'm so interested in this conversation, in engaging Canadians every single day about suffering, death, meaning, and hope, in working with medical professionals who want to practice in the Hippocratic tradition and to actually have a relationship of trust in that doctor-patient relationship. So I see it as a window to humanizing the culture to tackle this issue, because when else do we have so much of our humanity at stake in a question that really concerns all of us, because we will all suffer certain things and we will all die, but that doesn't threaten our lives. Meaning is to be found even in great suffering, and sometimes those bedside moments, sometimes that bedside reconciliation that happens between family members is the most important thing of a person's life or a person's relationship. So we would not want to miss that or cut that short.
Amanda Achtman, such a powerful message and such an important discussion. Thank you for coming in.
Thank you.
Thank you so much.